So we
Kitty
did do a
Chung?
roll call, and, okay, please call the roll call. Thank you.
Thank you, Madam Chair. Chair Jung,
Present?
Dr. John Novak,
Present.
Dr. George Hess,
Present.
Christopher Dare,
Present.
David Silverman,
Here.
Oscar Delgado, and Michael D. Brown.
Here.
Thank you.
We do have a quorum.
We do have a quorum.
Thank
Thank
you.
you.
Item number 2 is Pledge of the Allegiance. Mr. English, if you would please lead us in the pledge. Thank you, Mr. English. Item number 3, public comment.
Not at this time, Madam Chair.
Okay, thank you, Madam Clerk. Item 4 is the approval of today's agenda, which is January 26th of 2017. Do I have any changes, or?
I move to approve the agenda.
I have a motion by Novak, a second by Brown. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Mr. District Health Officer, please take it away.
Yes, next we have recognitions, and want to begin with years of service. We've got a number of recognitions today, so what I'd like is for people to stand when they're recognized, and then once we get done with the recognitions, we'll have photos with the board members up front. We have Nicole Sudi, or as we know her, Nicole Alberti, with 10 years of service in CCHS. We have, and congratulations, Nicole, for your service. Byron Collins, 10 years of service with EHS. Thank you and congratulations, Byron. We have Rebecca Gonzalez, who is not able to attend today, 15 years of service with CCHS. Julie Pomey, with 25 years of service as a nurse in CCHS, so congratulations and thank you. And then both with 20 years of service, Corey Sobrio and Kathy Sobrio, and I believe that they're celebrating that by vacationing this week. So next we have a promotion, Victoria Nicholson Hornblower, excuse me. Victoria is being promoted from Public Health Nurse 1 to the Public Health Nurse 2, so congratulations, Victoria, on your promotion. We have a new hire in vital statistics, and I'd like to ask Dr. Todd to introduce Blair Hedrick to us.
You want me to do that from back here or down?
You're on TV, sir.
Good afternoon, Randall Todd for the record, and it gives me pleasure to introduce Blair Hedrick. Blair is our newest addition to the Vital Records program. She started back on the 19th of December, and so she's been in major learning mode ever since and is doing quite well. She's catching on quickly, and we are very pleased to have her. Her previous position was with G4S Security Solutions.
Welcome. We have a bouncer now in the house. I love it. Good one, Novak.
And then lastly, Sandy Bridges retired from Vital Statistics. She had 21 years of service. She's not able to join us here today, but she was pleased in accepting her commemorative clock from the Health District for her 21 years of service. So congratulations to her.
Absolutely.
All right, so I think it's
I think
it's photo time.
Photo op.
All right.
Oh, I need to take my.
We need new stickers, doesn't it? Somebody we need to call for that. Once again, on three. 1, 2, 3. Great, thank you. Okay. Let me have you on 3. 1, 2, 3. Thank you. I think you should be the new chair. Victoria? Hi there. On 3. 1, 2, 3. Good. Thank you. Congratulations.
Blair, I hear she's doing fantastic.
On 3. 1, 2, 3. Very good. Thank you very much. Thank you. What do you use for? I use for.
Oh, thank you.
I can
Here's my agenda.
watch them. Thank you.
So again, congratulations to those of you with the longevity here and the promotions and also your retirement, and to Blair, congratulations on the new hire. I have a feeling that I skipped approval of the draft minutes.
No, not the
I think
agenda,
you-
consent agenda.
No, it's right here. Oh, it's on the, okay, so we can skip it, all right. Thank you, Mr. Vice Chairman. Now we can go to item number 7, consent items. Does anybody have anything they'd like to pull out or have further presentation? Is there any public comment?
Not at this time, Madam Chair.
Thank you, Madam Clerk.
Thank you.
If not, I will entertain a motion.
I move we accept the consent agenda.
I have a motion by Novak, a second by Dare. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Any opposed? That motion carries unanimously. Mr. District Health Officer.
Thank you, Madam Chair. Next, we have a public hearing. This is for review, discussion, and possible approval of proposed repeal and replacement of the regulations of the Washoe County District Board of Health governing invasive body decoration. And we have Mr. Jim English and Wes Rubio. It looks like Mr. Rubio will be presenting.
All right, Mr. Rubio.
Hello, Madam Chair, members of the board. For the record, my name is Wesley Rubio, Senior Environmental Health Specialist in Environmental Health. And before I get started, I'd like to do a special thanks to Byron Collins for his dedication and support and work on these regulations. He assisted as co-author and helped provide the information that we needed to move forward. So therefore, I am here to present this information to support the adoption of the proposed repeal and replacement of the invasive body decoration regulations. A staff report was included in your board packet that summarizes many of the proposed changes. The proposed regulations are in line with the District Board of Health strategic priority to create a healthier environment that allows people to safely enjoy everything Washoe County has to offer. The primary reason for updating the regulations is to be consistent with national standards of practice and create consistent terminology and applicability within the tattoo, piercing, and removal industries within Washoe County. Currently, the state of Nevada does not have any regulations governing this industry. Regulations exist in Washoe County, Carson Douglas, and Southern Nevada. The state of Nevada reached out to Washoe County and asked for training and aid in development of statewide regulations, while the Health District was researching and writing the proposed regulations before you. Since that time, the state has proposed regulations intended to go before legislature that are consistent with what is being proposed today. Washoe County attended public workshops for the state with representatives from Carson Douglas, Southern Nevada, where neither agency was opposed to the proposed regulations as they are. If the proposed repeal and replacement of these regulations is adopted, the Health District will work with all existing facilities and those requiring a permit to create a compliance timeline to allow each facility the necessary time to meet the requirements. This will include additional notification and site visits as necessary to work with the facility to meet the intent of the regulations. As such, these regulations should not cause any existing facility to close or have any major permit issues. The regulations do require additional documentation and practices and assurances that equipment is functional. However, these items will not cause any existing facility to close due to their implementation. Therefore, the Washoe County Health District Environmental Health Services recommends the District Board of Health repeal the existing regulations as originally approved on August 22nd, 2001, and replace with the proposed regulations of the Washoe County District Board of Health governing invasive body declaration and adoption of the proposed fees as provided. I'm available to answer any questions from the board, provide any clarification if you would like.
Thank you, Mr. Rubio. Is there any public comment here, Madam Clerk?
No, Madam Clerk.
Is there
go
anyone
ahead.
here from the industry that would like to speak who didn't know to fill out a public comment card? Okay, good. Any questions from the board? If not, I would entertain a motion.
So moved. Second?
Public hearing has opened. Thank you, Mr. Sack. So this is a public hearing, and I have duly formally opened it. There is no public comment. I have a motion by Dr. Novak and a second by Brown. Sorry, by Dr. Hess. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously, and congratulations that we are a model for the state. Let's remind them that when we go down there. We'll send them a bill, right? All right, next up is REMSA. Mr. Von Arx, and I don't see Romero.
Good afternoon, Madam Chair,
Hi.
members of the board, Don Von Arx from REMSA. Mr. Romero will be here in February to give you an operational update. Before you, you have two compliance reports, one for November, one for December. And even though there's 4 subcategories under 9, A, B, C, and D, there's 2 reports, and within the reports are the community activities you see in B and D. Happy to answer any questions you have about anything in the reports.
Start down here. Does anybody have any questions for Mr. Von Arx? Dr. Hess, Mr. Silverman?
Dr. Hess, we have gender information and demographics.
I like that. Thank
Okay.
you.
December was perfect as far as getting all the respondents to give us that demographic information.
Appreciate
Wow.
it. Thank you.
Yeah, thanks. There are 2 action items here, item A and item C.
Correct.
So, Assistant District Attorney, would you like us to take them separately, or?
The board can take them together.
Okay, okay, if I can get a motion on item 9A and 9C, the review and acceptance of REMSA ops for November and December. I have a motion by Brown, a second by Dare. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Item number 10 is REMSA Advisory Board January meeting summary, and we have presenting Ms. Christina Conti.
It is.
Hi, Christina Conti for the record. We had our quarterly EMS Advisory Board meeting in January, and so this provides you with a summary of what was discussed there. Just a couple things to point out to you or bring to your attention. In the EMS Oversight Program Data Report section, it was during that board item that it was determined that quarterly reports will no longer be produced. I want to point that out because obviously we are your program, and if there are still things that you would like to look at on a quarterly basis, then we will provide that during District Board of Health meetings. But it will not be formally going through the advisory board anymore. That will be a robust annual data report with a mid-year check-in, if you will. And the last item to bring to your attention would be on page 2, which is the Regional Protocol Project. It's moving along very well. We're very pleased with the product that we got from the consulting company and the direction that the region is going. The meetings begin in the next couple of weeks, and so we're really hopeful that we're going to have a solid product for the region by the end of this time. And I'm available for any questions on anything.
Questions for Ms. Conti? Good job.
Thank you.
Thank you. Item 11 is presentation, discussion, and possible approval of the Regional Emergency Medical Services, REMSA, franchise compliance report for the period of 7/1/2015 through 6/30/2016. And I understand Brittany Dayton will be presenting, Dr. Todd, is that correct? Thank you.
Good afternoon, Chairwoman Jung, members of the board. Brittany Dayton, EMS Coordinator for the record. Today I'm presenting the REMSA Franchise Compliance Report for fiscal year 15-16. This is an item that I present annually to the board and is an assessment of REMSA's adherence to the requirements in the franchise agreement. Attached to my staff report is the completed compliance report. I also have copies of the compliance checklist, which is the document I use to track all information that I am collecting throughout the review period. So should a board member want a copy, I have copies with me. The compliance report is structured in similar fashion to the franchise agreement. It includes the 17 franchise articles and associated subarticles and whether REMSA met the requirement via the documentation that was submitted to or gathered by the health district. For each applicable article, there's a narrative on the information provided and the analysis completed as appropriate. For fiscal year 15-16, REMSA met all the requirements except for Article 8.1, which is the average patient bill. This can be found on page 11 of the report. REMSA reported their 4 cents overage at the December District Board of Health meeting, and the district health officer enacted Article 8.3 of the franchise to address this overage. However, it's important to note that compliance with Article 8.3 cannot be determined until the next reporting period. Therefore, since REMSA has complied with the enactment of Article 8.3 and met the requirements of the franchise checklist, staff is recommending that the District Board of Health find REMSA in compliance with terms of the franchise agreement for fiscal year 15-16. And with that, I'd be happy to answer any questions.
Are there any questions? I'll start down here. First, Mr. Silverman or Dr. Hess?
None for me.
Okay. Any questions? Yes, Dr. Novak.
May not be totally pertinent right here, but in your 5.2, we referring to the CAD system. Can you give me kind of any update where we are with the whole program? I know we've had logistical problems with servers and everything else. Are we making progress? Or?
I might not be the most appropriate person to answer that question. The city of Reno had taken that on, and I don't know if anyone in the audience would like to provide additional information.
Chief Cochran, would you like to address Dr. Novak's question?
Good afternoon, Dave Cochran, Reno Fire Chief for the record. The process is moving forward. We, the City of Reno, have signed a contract with Tiburon, or Tritech, whoever the surviving entity is. They are waiting to find room on their schedule to begin implementation of the process. We expect that to be June, July this year. And then we're moving forward. So it had always been contemplated that Reno would administer the implementation of the CAD/CAD. So that's why we signed the contract. We're still working out the funding, but Reno's committed to pay for that. So the process will move forward, and then we'll talk to the county and Sparks about joining in.
Thank you. I know there were some problems with Tiburon and Tritech moving back and forth. So.
Right. But yeah, the process is moving forward, and really the hang up now, like I said, is just finding time in their schedule to get it done here.
Thank you.
Christina Conti for the record. Dr. Novak, I apologize. When you asked the question, I realized that at the last meeting I had said that what is included in the EMS Advisory Board meeting for the CAD/CAD update that's provided by Rishma from the City of Reno IT, I would include in my report so that you guys could always have the same information that's presented to the board. So with Mr. Dick's permission, I'll forward it to him and he can forward it to you guys so that you'll have that documentation as well.
Okay. No, I kind of know we're moving, so that's good. Thank you.
Thank you, Ms. Conti. Any other questions for Ms. Dayton or the report? Does REMSA have anything that they want to add to this report? Okay.
Could I make a?
Oh, yes, Mr. District Health Officer.
I just wanted to thank Ms. Dayton for the rigor of the review that she's conducting for compliance with REMSA. Historically, the health district had been criticized for not being rigorous in the oversight of the franchise agreement, and I'd like to draw the board's attention to the two massive notebooks that Ms. Dayton has sitting next to her seat there, which she's compiled all the information that this is based on.
Yeah, I echo that. Good job.
you.
I think you've developed for us a lot of credibility and trust for not only the oversight of REMSA, but the communication and belief that we are overseeing them at the public at large.
Thank you very much.
Kitty?
Yeah,
I just want to say I'm obviously brand new on here, and so I'm learning a lot of things. But one of the things when I even ran and watched years ago, there was some different issues, and it's neat reading these things, watching everything come together. And so thank you. I know obviously you guys worked very diligently as a board, putting all this together and things, but it does seem that we are definitely heading in a very good direction for our region and for our cities. Thank you.
Thank you.
any other comments? This is an action item. Would you like to approve the franchise compliance report for the fiscal year?
Make a motion to approve.
I have a motion by Brown, second by Novak. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Mr. Kevin Dick.
Yes, next we have a presentation and possible acceptance of a progress report on the 2016-2018 strategic plan. And Ms. Rogers, if you could bring up those slides.
And you also have this?
Yes, everybody should also have an additional update on the strategic plan.
There you have it on this screen.
We have all new electronic devices here, it's just so everybody knows. That's why the Board of Commissioners was meeting actually in the health old meeting room for a few months while this was all, if you notice, this is all new, so please bear with us. The Board of County Commissioners have had quite a few hiccups, too. Oh, duh. Thank you.
So the
You know, we can
intent
go
of
through,
my-
here's the
intent of my
deal, we can put this online, right? And we all do have
Yeah, let's-
the handout, so let's, while Ms. Rogers is working on that, let's have Mr. Dick go over his plan, and then let's make sure we have a link on our front page of our website.
And my intent with the slides was just to remind the board of the mission and values, and there we go, vision statement and strategic direction that we established in the strategic plan, which we are now implementing.
Okay?
And the 6 strategic priorities, which is the next slide, that we established within our strategic plan. The strategic plan is very real for the health district. It's something that on a monthly basis, I am meeting with the division directors, and we are assessing our status across all of the different initiatives that are built into our action plan. It's something that on a bi-monthly basis, we're meeting with all of the supervisors in the health district to review the plan and our progress. So we have made progress over the initial 6 months of the plan, and on the back of the two-pager that we have are the accomplishments, a sampling of some of them that we've achieved over the first 6 months of the implementation. We had established a 2020 target of 80% as the percentage of children 19 to 35 months old who received the recommended doses of vaccine. And as of the 2016 data, we have actually exceeded that 80% target. So congratulations to our immunization program and all the immunization providers in our community with exceeding that target of 80%. We'll we're not just going to check the box and say we're done. We'll continue to promote and try to increase our percentage of vaccinated. Also, as we've had more data roll in, we have exceeded the target that we had set for food insecure children. That has declined from 27% in 2012 to 2014 to 23.8 in 2014. Now, obviously, that's not something that we achieved with our strategic plan over the last few months when that data is coming from 2014, but it's certainly fantastic to see that that number is coming down, and we'll continue to work on reducing it. Our high school graduation rates also are moving beyond the target that we had established for 2018, with 2016 data reflecting a 77% graduation rate in the Washoe County schools. So these are very encouraging to see these moving in this direction, and we'll continue to work on our initiatives that are intended to improve those numbers even more. As far as initiatives that we will take full responsibility for, that we've accomplished during this period, in administrative health services, for instance, under strengthening our workforce, staff are being encouraged to partake in professional development opportunities, and this is being integrated into their performance evaluations. That's actually occurring now throughout the health district as we're conducting those evaluations. We've expanded the air quality monitoring network with a new monitoring station that's located up at Lazy 5 Park in Spanish Springs. And I believe that at some date in the future, while we're collecting data for record now, I believe we'll have an event out there to sort of have an open house for it and show the community that expansion, an important expansion into an area that's developed significantly over the years. It hadn't had a monitoring station. In community and clinical health services, the Wolfpack Coaches Challenge was implemented with Washoe County elementary schools. They've achieved their goals. They're going to continue to work with the school district to have that as a recurring event in the schools or program. In environmental health services, the new risk-based form and inspection process for food establishments is being implemented. In epidemiology and public health preparedness, the Washoe County antibiogram has been completed, and that's now being done annually. And in my office, we submitted recommendations to the Interim Legislative Committee on Healthcare for consideration for legislation this session, and we've established staffing for Truckee Meadows Healthy Communities, with Sharon Zadra being brought on board as the project director. So these are just some of the highlights of where we're at with our strategic plan. I'll be bringing back another quarterly update for you in about 3 months' time. Be happy to take any.
Okay, Dr. Hess.
Yeah, I had a question when I read this as to, something that we had actually done, and you've definitely answered that question, and congratulations. On these things, though, they're dynamic, so hopefully they'll continue to be looked at. Is that your plan?
Absolutely. We'll continue to look at those outcome measures and assess where we're at. And as new data comes out some of these are just annual data points, we'll provide that data back to the board.
Any other questions? Well, first I have to say thanks to Beth McMillan for being your model on our health district strategic plan. That's Miss Arttown, if you don't recognize her. I do have a question or direction for staff. Since we have these 6 priorities, can we, going forward, identify them in the agenda? Basically, how is this staff item supporting one of these six of these 6, one of these 6? Because if it doesn't support one of these 6, probably shouldn't be something that we're doing or presenting to this board or using staff time on.
Mm-hmm.
So that's, if you need help, Madam Clerk, just look at the Board of County Commissioners. We started doing that last year as well. And it's helped us narrow, and especially on our board, because it's all elected officials, people come up with some wild ideas that they want staff to pursue, and we say, look at our priorities. Does this fit within what the county does? So this will help we don't have a problem with that here, but it will also help staff become more familiar with what exactly those 6 priorities are. Anybody else have any feedback? All right, this is an action item. I would entertain a motion for acceptance.
I'll move we accept the report.
So I have a motion by Hess, second by Silverman. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion also carries unanimously. Mr. District Health Officer, item 13.
Yes, item 13 is an update regarding the bill draft requests and bill drafts for the 2017 legislative session and consideration and possible approval of District Board of Health legislative principles. This item also includes the legislative principles that were in your packet, and then we had provided and posted an additional document, the 2017 Nevada legislative session update for the January District Board of Health meeting that I'll be discussing. I apologize, I realize there's a typo on the staff report. This is for our board meeting date of February 26th. It says on the staff report, this is for actually for today's meeting, the January 26th meeting. I may have been thinking of the session starting in February when I
Right.
put this together. So there are 2 different items that I'd like to review with you. The first being the legislative principles. And so the legislature is going to be beginning in session February 6th. And things start happening pretty quick as they get into session, and bills are getting assigned to committees, and hearings are being scheduled for those bills, et cetera. And as a board that meets monthly, it's important that we have an understanding of what the principles are for this board regarding legislation that's happening in Carson City and that dynamic environment that's going on. And so the document of the Washoe County Health District 2017 legislative principles is drafted for your consideration as far as the principles that will guide decision-making of the board, but also the response to happenings within the legislature, amendments that are made to bills, new bills showing up in between the board meetings. And so I don't know if, hopefully everybody's had a chance to review this. We had one that we established during the 2015 legislative session that is fairly similar to this one. I would say that the addition that's been provided in this one is in part due to the strategic plan and our financial sustainability and ability to build programs over time to impact positively the health in our community. So under long-term sustainable solutions, I did include some additional language about state funding per capita for public health being 51st in the nation, and the importance of the state increasing its investment in public health. I also wanted to emphasize that the health district considers itself to be a partner with the state in implementing programs locally to enhance public health. The governor announced in his state of the state the Controlled Substance Abuse Prevention Act that he's going to be introducing. So I also wanted to express in this the health district's support for that initiative, but recognizing that that can't just be a state-level initiative, that the health district needs to be meaningfully engaged in that, and we need to have resources provided locally to address behavioral health issues.
Any questions or comments or additions? Let me sort of explain how this works. So, because things do move so very quickly at the legislature, right, and staff is monitoring those issues, they can't always come and have a board meeting. We can call an emergency meeting, and that's fine, but usually if even the 3-day posting notice, we've missed the boat. So this informs every staff member and lobbyist that we hire to carry forward what our values are in moving that quickly. This is what they look at to see that if we're in accordance. And of course, they call me, and they'll call the vice chair if they can't get a hold of me, but I would always go back to this too, because we're a board, right? Not just me in charge of it. So I think this is great, and it's really more for staff, but it's good for you too. If you get questions, why aren't you supporting this? Why didn't the board do this? Why is the board going after fluoridation of water, for instance? You can go back to these guiding principles and explain your situation. I also would encourage staff to use the subject matter experts on this board whenever there is a need to testify. You know, a Dr. Hess is a retired GP, is far more powerful than a Steve Cutts, no offense, Mr. Cutts, in terms of giving testimony at the legislature as to why the board has taken this position or taken the other position on that, or is completely neutral in the position. So who is our staff lead for BDR tracking, and is that you?
Well, Ms. Rogers is the lead in working with, and we work with the county's bill track
Good, I was going to
system.
ask about that too.
And so she's going to be the quarterback in
Okay.
assigning out to the appropriate divisions
Good.
the bills to be reviewing and commenting on, and coordinating, and I'll be working closely with her on that and coordinating who will be providing testimony.
Okay,
I've registered as a lobbyist, so
Okay.
I'll be available for that capacity as well during this session, but we'll have staff, and thank you for mentioning the board members providing subject matter expert testimony. That actually is one of my strategic plan initiatives, so you've just helped me out
oh,
with that.
good, thanks. Because it is compelling, and so just staff can remember that too, and I know you guys are moving so fast, you know, somebody somewhere, maybe it is our quarterback, can say, hey, did we think if there's somebody from the board that would and could talk on this? And like I said, doesn't need to be me, go to who the subject matter expert is. I think I had another question, but I can't remember it now, but I think this is a great guiding principle, and I want to encourage the district subject matter expert staff level, when you are down there or going down there, or any of us speaks to an elected official at the state level, make sure you follow back up and let Mr. Dick know so that he can let our chief lobbyist at the county know, and then make sure the county and the health district are not working across purposes or not communicating with each other. That's the worst thing, and it's happened to us before too, and I really got my head tore off a few sessions ago by Mr. Oseguera, because he was getting two different messages from the Board of Health. I don't know if you remember this. So in as much as we can do that, it makes it so much easier for these people that really do control us to get the right information and work on the right information, and not to get frustrated with us wasting their, you know, to them, it's just kind of a waste of time if we can't get our story straight. Any other additions?
Just a question.
Dr.
I
Novak?
remember the last legislative session, we had a large spreadsheet. Will we be developing that again this year? Because I know there's just a few bills coming up, like 800 or 1,000.
You're right, just a little,
Yeah.
a little bit.
So we can have a spreadsheet like that, and we have a spreadsheet that we're maintaining right now. But I did not want to dump that on the board this month, because we have, I think as of today, 816 BDRs, which only have a one-line description of what it is. And so until the bill text comes out, we really don't know if that's
fine.
yeah. And that's why,
I found it
yeah.
getting towards the middle of the session, it became very
Yeah.
important.
And that's why I've provided for this meeting, since we've got a smaller number of bill texts that are available, 168 so far. We've reviewed those, and of those identified these bills that we feel are ones that are pertinent for the health district. And I'd be happy to run through these or highlight some of these for
Do
you.
you need that at this point, or should we wait until the bell is actually called? Because we don't know if half of this won't even look the same, nor
And
will they be heard.
I think by
guess-
only,
What would be important for me would be, so we've taken a stab at what our position is.
Okay.
And if somebody really feels like our position should be different than what we've noted on a bill, that would be important, I think, to discuss.
Does anybody have, yeah,
I think my only
Councilman Dare?
I think my only question would be making sure that is there anything that you guys see that we're against? I mean, obviously, we have a lot of support and a lot of neutral, and those are gonna, it's probably you're right. I agree, we can wait to see those, but if anything you're against, I think it's something I'd like to watch. And I don't see anything on here, so that means I appreciate government, but I don't think they always do that. I mean, it has to be something you're against, I think. So
Well-
is there something that we need to be watching a little closer, that we need to be paying attention to?
There will be some things that we're going to be opposed to, I'm sure, before the session is out. So, some of the items in these bills were neutral at this point, but we don't really know what we could end up being opposed to that. And so a couple of those would be SB 60, which it provides for Medicaid reimbursement for governmental entities and Indian tribes for ambulance services, but it also seems to provide billing for EMT, advanced EMT, and paramedics in pre-stabilizing patients and preparing patients for transports. My note on that one is it looks like this is a bill that would provide billing from fire agencies that aren't transporting for EMS response, and is that billing somebody for something that taxes are already being paid to support. So that's my note there. I don't know what our position should be with that. And it would be, that aspect of the bill that I noted a concern with. On SB 77, this is to establish an evidence-based practice committee at the state level that would identify evidence-based practices for school districts to use for safe, respectful learning environments and bully-free and cyber-bullying-free zones. It does provide for that committee to approve other practices to be used in the schools, but it's not yet clear to us whether that provision is going to be sufficient enough. If Washoe County School District has got data analysis that they're doing, and they've got incredible amount of data they analyze in their schools, whether that's going to be amenable for them to be able to design policies and practices that they think are appropriate for their schools if it's not in the evidence base for this committee and if the committee is not willing to approve those. So those are a couple that right now we're saying neutral, but we're really kind of trying to figure it out a little bit better.
Thank you.
Any other questions? Good summary.
Thank you.
All right. Possible approval of our legislative principles. Do I have a motion?
I so move.
I have a motion by Novak, second by Dare. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. Any opposed? That motion carries unanimously. Mr. District Health Officer.
Thank you, Madam Chair. We're at item 14, staff reports and program updates. And first, we have air quality management, Ms. Charlene Albee.
Do you have anything additional? I'll start down here. Are there any questions on her report, Ms. Albee's report? Thank you, Ms. Albee.
Next, we have community and clinical health services, Steve Cutts.
Good afternoon, Madam Chair, members of the Board of Health. Steve Cutts for the record. Just a couple of things. Wow, this is loud. We're going to show you a video in just a moment. A few things I just wanted to go over first. Last time at the December Board of Health meeting, there was a question regarding flu rates. So I did look those up and got information from our state immunization program. And for the 15-16 flu season, overall, Washoe County was at a 27% overall coverage for flu. Not great. It is not great across the U.S. And so far to date, this year, it's 19%. One of the challenges with the data is that while it is by law, you are to put immunizations into WebIZ, which is the state immunization registry. Not everybody does it. I asked Doug Banghart at the State Health Division, Division of Public and Behavioral Health, when will final numbers be reached? And he said they never really, there's never really a final number. They settle, is how he termed it. So I just wanted to let you know that. Mr. Dick had mentioned our immunization rates of over 80% in Washoe County. I just wanted to note that I've been hearing about, and prior to being division director, was heavily involved in immunizations the whole rest of my career here at the health district, and we've been hearing about an 80% immunization rate for 2 and under, at least back to Healthy People 2010, if not Healthy People 2000. So it's pretty exciting that we've actually met and exceeded that rate. And as Mr. Dick mentioned, we're absolutely, just because we've reached that does not mean we're done. We always have a new cohort of 2-year-olds, so it's constantly a moving target. We're definitely keeping our eyes on that. And with that, I think I'm ready to show the video. So this video goes in conjunction, and in the board report, I talk about the Safe Sleep statewide work group that myself, Linda Gabor, and Jan Hauk, public health nursing supervisor and public health nurse respectively, are part of. Southern Nevada Health District just got on board with it, so we literally have face-to-face meetings via the internet. So it's been very good, been very collaborative. We're happy to have this updated video that the State Health Division of Public and Behavioral Health really helped push. And then we do have the new brochure, which is the last 2 pages front and back of our board report. And with that, we will attempt to show the, oh good, okay.
Oops.
There's volume to it.
The problem being,
Who made the video, Mr. Cutts?
It is a national campaign. It is the Cribs for Kids campaign. Yeah. It's great. And I know, so I don't know if we'll be able to show it with volume. It's great to because it really emphasizes just the separate sleeping space for the baby. No bumper pads, no blankets in there, soft stuffed animals that can get in the way of the infant's breathing. So it's great information.
Do you have this in Spanish as well?
Yes, actually.
And the brochure in Spanish?
Yes, we do.
Great.
Yes, both.
Any questions for Mr. Cutts? Yeah,
Where do
Councilman Dare.
we end up putting this information when we get this out? Is there, like, how do we get this out into our community? Because obviously this is some important things. We have the different
sure.
communities.
So the public service announcement is going to go out over media. State Health Division worked with Nevada Broadcasters Association, so they get at least a 2-for-1 buy. So they put in X number of dollars, and Nevada Broadcasters Association assures that they get 2, if not 3 or 4 times the amount of coverage that they pay for. So it's scattered across the 24-hour period. Not all of it is in prime time. Some of it is at 2 a.m. I did just happen to hear the radio spot this morning as I was getting ready, coming to work. So it's radio, it's TV. We have the brochures. We're getting them into doctors' offices. We have them at the health district in, we're getting the finalized version. We've had the older version in all of our clinics, our WIC clinic. We promote it throughout the community. It hits our Maternal Child Health Coalition, and there are a number of providers and service organizations throughout the community.
Do we end up bringing them like down City of Sparks? I mean, this would be something it's a trifold, right? Is it a?
Yes, so it could go in a,
So
yes,
do you get
if
them to
City
the
of Sparks would be happy to have that, I would be happy to
Yeah,
get some for you.
I'm sure Reno would too. They're not here, so I can say anything I want.
Yeah.
So I know Reno wants a lot of them, and so
Sure.
I'm new. I can say a lot of things.
Absolutely.
So I think it's wise to get them out, and obviously we are the health district, and I think it would be important to get them to the cities.
Sure.
And I see REMS as a major partner in this, and I'm assuming that also REMSA and fire and other first responders will have these because they see people at risk
Right.
more than a radio
Absolutely.
spot does or a TV
Yes,
spot.
I know for sure REMSA does. I can check with the work group as to if it goes out to fire districts.
And police officers, I mean, they really see the potential
Yeah.
for some
Yes.
unsafe sleeping
Yes.
situation. I know JD is TW,
JW.
JD,
JW.
JW. I know that he's a high-level lobbyist for REMSA, but he's also an actual EMT. And he told me a story where same family, two babies sleeping death, but they fell asleep on their baby twice, like two different babies dead. So they know. I mean, I always want to go to the first responders because I think they are the most, even more than a
Sure.
doctor's office, right?
Sure. Yes. Oh, and so,
And even if they know who to call, if they look at the brochure and say, okay, I can call REMSA here at 858-5700
Right.
to say, hey, we need to do some sort of proactive intervention.
oh, yes, absolutely. We'd much rather be proactive than reactive after the fact.
Sure.
Yes.
Okay.
And I two final comments. What Chair Jung had said about the legislature and often dealing with other physicians in the community, they absolutely love to hear from the physician. So we did enlist Dr. Hess's help when we were dealing with our syphilis outbreak initially a couple years back. And we do enlist our medical consultants that we contract with in
Great.
dealing with other physicians in the community. They respond better to
Absolutely.
physicians. Yeah,
Yep.
absolutely. Okay,
Thank you, Mr. Cutts.
Any
Any other
questions
questions or
for me?
comments? Thank you. Good job.
thank you.
14C?
Yes, next we have Environmental Health Services. Mr. Sack.
Madam Chairman, members of the board, I'm Bob Sack, Division Director of Environmental Health. Just wanted to highlight, our report. We've got a lot going on right now, but I wanted to highlight a couple of the flood-related things. First, to thank our staff for, the efforts they put in and flexibility they put in. We diverted them from all their work for a few days to do assessments on any of the flood-damaged areas related to any of our permitted facilities or anything else. Second of all, I wanted to point out that Sutcliffe on the Indian Reservation lost all of its water as part of that flood. And I wanted to commend a couple of our staff, Jim English and Wes Rubio, for the work they did with Tumwa on getting water out there. But our staff worked with them, but Tumwa mobilized its staff, its equipment, and put a tremendous amount of effort into getting a water system back up for those people to work with. And it's not their water system, they jumped right on it and did an absolutely phenomenal job. So
That's
I just
great.
wanted to point those out as far as.
That might be a good special interest story to pitch to some different news venues vis-a-vis Mr. Ulibarri.
Mhm.
Because, Tumwa is always getting thrashed. that They're too expensive and they're not.
I want to point out, they jumped in with both feet with no regard really for the cost of this.
That's wonderful. Dr. Novak?
Would it be appropriate if this board sent a note to Tumwa, tell them how
Yeah.
much we appreciate what they did?
Yeah, I think it would behoove in some way, whether it's this board, the county commission, something, I think they do deserve to have some recognition.
Yeah.
So,
I think that would be
Okay,
just a good PR move.
it's a great idea. We'll take-
Perhaps,
we'll take
perhaps
care of
we
that.
could invite them to be recognized during the next
Sure.
Board of Health.
Yeah.
That would even be better.
Great. Anything else?
No, that's.
Does anybody have any questions for environmental? Yes, Councilman Dare.
I just want to say that it was fascinating and awesome watching the region function together. And obviously, as the county, you guys in some ways get to put your arms out around all of it. And over the years of watching, there are people who might wonder what the different entities do and how they function. But I got to tell you, when the water hits or problems hit, everybody just got into play, and they did a fantastic job. So your team did a fantastic job.
Yeah, and we're one component of
Yeah.
those organizations.
Yeah.
And I think we all work very well together.
All right, thank you.
All right. Next, we have epidemiology and public health preparedness. Dr. Todd.
Good afternoon again, Randall Todd for the record. I just wanted to point out.
Can you speak closer to the microphone. Thank you.
Can you hear me now?
Yep.
Okay. I just wanted to point out a few things that were in my prepared report and draw your attention to them. Firstly, with Zika virus, we have had no locally acquired cases. We don't have the mosquito vector for there to be locally acquired cases, but among returning travelers that we've tested some 59 individuals, 5 were identified as cases. One of those was a pregnant woman. And so we'd been following this case with some interest for a period of time. I'm pleased to report that she delivered her baby on January the 11th, and thus far, baby's healthy.
Wow.
So they are still continuing to monitor both the mom and the baby, because in some instances there can be Zika-associated problems that might manifest a little bit later. But it's very good news that that the initial outcome appeared to be positive. And then I just wanted to mention the next item down at the bottom of that page on publications. We did have an article published in the Morbidity and Mortality Weekly Report. In the years that I've worked here and in public health, and we've had not a huge number of MMWR publications, but I have never had one that generated this much media interest. I think we're up to some 20 interviews.
Wow.
that came from just that one little one-page article that was published in the MMWR, and they've some of the reporters have contacted us from as far away as Great Britain, and so it's been interesting. And then finally, I just want to point out there was a typographical error in my initially submitted report on the expanded surveillance of carbapenem-resistant bacteria. I referenced NAC 441A.234, and I should have referenced .235.
Yeah, we
There
caught
is no-
that. We caught
There
that
is
right
no,
away.
there is no 234.
Figured it when I went and looked.
And other than that, I'd be happy to entertain any questions that the board might have.
Yes, sir. And first of all, congratulations to you and to Dr. Chen for that published article. That's kind of a big deal in your field.
Yes, it is.
Any questions? How are we doing with flu? I know Mr. Cutts had some info. Where are we in the flu season? Are we in the middle?
Well, I think we're approaching the middle. We're not quite to the middle yet. It started off as a really significant flu season. It then appears to have moderated somewhat. You know, in fact, if you look at the charts, you would say it appears to have peaked. But sometimes we get a secondary peak later in the season. So I'm not willing to say for absolute certain that it has peaked. But
Right.
you know, it's bumping along as a fairly moderate flu season.
And would you still recommend to people whom have not been vaccinated to get vaccinated?
Absolutely.
And what if they think they've already had the flu, that they don't need the vaccination?
Well, we don't know if they did have the flu, was it the flu that was covered in the vaccine? Because as you know, there are multiple strains of the flu virus. And so even if they believe that they've had the flu, if they've recovered from that, I would say they should still get their flu shot.
Okay, great. Good advice. Any questions? Thank you, Dr. Todd.
All right. Next is my report, the Office of the District Health Officer. And I also wanted to talk a little bit about the flood, our preparedness and the response to that. Bob mentioned, or Mr. Sack mentioned his staff. I wanted to also acknowledge Mr. Sack himself was very active in this, both at the Regional Emergency Ops Center, but also at the Sparks Emergency Operations Center, where he was part of the leadership team and the response to that. Wanted to acknowledge our public health preparedness and EMS staff who provided staffing at the REOC 24/7 through the level 3 activation that was occurring there. And also provided significant support with WebEOC, which is the software platform that's used for communicating and documenting information during an emergency response, which many of the people involved in responding and at the REOC were not really up to speed on. So helping people get a login, helping people understand how to use the system. Dr. Todd actually built a damage assessment board for the region to use during the event. I wanted to recognize Mr. Uliberry, who participated as part of the joint information, the JIC, joint
Yeah, we got it.
Council?
communications team, Joint
Center.
Information Center, the JIC, in working on the regional communications, but also who participated with the tour for the state damage assessment team, and we'll be working with the FEMA damage assessment team. I've got some slides that we have of some of the flood damage in the area, and we can kind of scroll through these quickly. Some of the damage up at Pyramid Lake. Crosby's Lodge, which we regulate as part of Washoe County, not part of the reservation, was not damaged, but the reservation land extensively. These are some of our tanks that our preparedness program has, which were originally intended to provide potable water to hospitals, but we used those up there. This is wash out of the road, out to the ranches.
Wow.
Another picture of that. Yeah. Northern Washoe County. That's by Red Rock. Rancho Haven by Silver Knolls. Valley. Sun Valley. And this is one, actually if we back up one, this is one that our staff found when they were driving around doing their windshield assessment. This is over by Horseman's Park, and an incredible amount of water had accumulated in there. And so we got people notified, and Public Works got out there, and I don't know how they released that water, but I'm glad they got it out of there before it just went downhill on people. And this is from yesterday. Truckee Meadows Healthy Communities held another quarterly Family Health Festival. So this was over at Reno Town Mall, and provided a number of different services, all coordinated there at the same time for community members to take advantage of. I wanted to mention also that the Truckee Meadows Healthy Communities held a forum on January 12th for affordable housing for the region, which we had enterprise community partners come in to facilitate that meeting. We developed a pretty good consensus around a vision for affordable housing for the region that is a continuum of housing addressing needs from homeless and supportive housing services to affordable housing for disadvantaged low-income populations through the range of housing to support workforce housing in the area. The consensus was we needed to have another day for people to work together around this to be able to come to a point to build a strategic plan for how to move forward. So we're working on organizing that now. I had one last thing on the flood too that I wanted to mention. We talked about the work with Tumwa that Mr. English and Mr. Rubio were engaged with. Lyon County also stepped up with that, and we were using their potable water haulers to truck water from Spanish Springs up there to Pyramid Lake. So it was quite a regional effort to support the tribe there, most of which was occurring over a weekend. So appreciate the efforts that were made there.
Any questions from the District Health Councilman Dare?
I have a quick one with the Truckee Meadows Health Community. I don't know that I didn't know they were doing that, and part of me wonders, is there a way to get them to come out and in front of the City Council Sparks do a little, because they do the little intro, make sure people know when. Because
Mhm.
again, I don't know that our community knew.
Actually, this was an invitation-only event because they wanted to limit the size of the group. But we had Mayor Pro Tem Ron Smith was involved and attended there. We had Armando Ornalas from City of Sparks. Jim Rondell with planning was involved. So I know at least those 3 people from Sparks were represented there.
So it's not something you guys wanted out. Okay, gotcha.
It was trying to get a cross-section of the right people to have there, but to have it be fit inside the room we had and be manageable to try to facilitate that process.
Makes sense.
Any other questions? All right, that leads us to item 15, board comment. I will start down here. Mr. Silverman, do you have anything? Request for future agenda items?
No,
Oh.
no, but thank you. I just wanted to say thank you. This will be my last board meeting. I appreciate the opportunity and am thankful to work with the staff and the division directors and the board members. This is a very complex, comprehensive organization and what you all do here, and I've had a firsthand opportunity to see what you do. Kevin, really appreciate the efforts you've done and what the team has done. I've been the beneficiary of sitting on this board. I think it's important to have diversity on boards and perspectives and experiences, and I know I won't be getting any calls from Dr. Todd regarding any epidemiology questions, but as I shared with Mr. Sack, if there's any opportunity in the future to assist you with anything, given, you know, the limited amount I do bring, I'm happy to do that. So again, thank you. It was a pleasure to work with you all, so thank you.
We're going to miss you. Dr. Hess?
No, but I just want to echo that we will miss you.
Yeah, you guys are buddies down there.
We are.
We're going to move Dr. Hess in, so he's not out by himself over there.
I'll miss
Dr.
you too.
Novak? Do you have
Anybody will sit by George now?
I'll get to that. Chief Brown?
Say, David, thank you. We talked before the meeting, and he said his phone will be on and available for questions that have to do with his area of expertise, which was a great cross-section.
Absolutely.
Thank you for assisting. You helped me tremendously with the food industry.
Absolutely. Councilman Dare? No. So I echo what everybody has said here. I begged him, made a phone call in the evening to please don't go, whatever we can do. And Mr. Silverman, unfortunately, he runs 2 restaurants, and the timing that we have this meeting on a Thursday is not lovely for him. And he has two growing children, and he expressed to me that because then after I begged him, he said he'd think about it, and then we met at one of his restaurants. And he said that his children are at the age that they still want to hang out with them, so he wants to hang out with them while they still do. And I get that. I think more parents should be more conscious of that sacrifice and how important it is. So I thank you so much for your service. We will, when your kids get sick of you, apply again. Okay. But I want to ask Environmental Health Services to be on the lookout and soliciting other restaurateurs that you know that would be a good fit to sit up here, because that will be a major gap for us, is somebody that knows the food industry. And your inspectors know who's great and who would do a good job at educating us as well. So if we could get that out there and get this filled sooner rather than later.
Did you offer to double his salary?
I offered to double, triple. We will miss you. Thank you. Anything else from the board? All right, public comment, Madam Clerk. Do you have a public comment?
Not at this time, Madam Chair.
Okay. Well, with that, I will say this meeting is now adjourned. Thank you, everyone. Nice job to you, sir. Sorry I was late.